other studies that you feel will impact you one way or another, something that you will start doing or stop doing?
Well, it's not going to start for me, it's not going to be a beginning of a change of practice, but it certainly reinforce what I'm already doing. And that's the BMI, the body mass index. You know, I went to a breast conference with Joyce O'Shaughnessy in La Jolla this summer, and that was a tremendous stress that, you know, that we're just not paying attention to our patients. You know, we just give them this little pill in this huge body. I mean, there's all these hormones, all this body mass. It is so important. And, you know, there was a data saying that if physicians who do not exercise do not address the exercise issue with their patients. And when the patients come in, and I say, you know, I don't have to do anything except to see if they're taking the pill, if they have any side effects from the pill. But I'm looking at that person who's going to be alive for the next 20 years. We have done such a great job with the cancer, and now they're sitting duck to get all these other things. And so I think, you know, I have a chart with body mass index on each wall in each examining room, and I calculate and I tell them, and we have little goals, you know, by the next, and I give them things that are not off the wall, you know, some weird diet. You just to have and you have to give them guidelines. You can't just tell them, I want you to do better. What does that mean?
Well, you know, the headline of one of the releases here at the meeting.
Yeah.
Obese women with ER positive and HER2 negative breast cancer
Have decreased survival.
Have poor survival
Yes,
rates.
we knew that.
So knowing, and also that obesity was associated with inferior survival in women with stage 1 to 3 breast cancer. Yes. Now, somehow seeing it in writing, I guess you might scare someone.
And I'm going to Xerox
weight.
those things, and I have a file in each room, and I give them that. Now, what we do in my area, we have Cancer Foundation for Life, and we have Fit Steps, it's called, a program. And the minute the patient comes to my office, part of her treatment is an exercise program and a diet modification. We find out what she's eating, and we're doing, you know, decreasing intake, modification of what she's eating, and increase output, you know, increase exercise.
This isn't a new intervention strategy, because up until now we've really been talking about obesity in the framework of prevention. You know, breast cancer prevention, it's very important to be proactive, and to, you know, obesity being a really significant risk factor. But now we're looking at obesity and prevention to reduce risk of recurrence.
Yes.
Or impacting survival if you have, you know, disease, period. And I think this is a paradigm shift.
Yeah, and there's a data that actually decreased body mass index could be just as effective as the hormonal therapy itself. And there's decreased hormonal effectiveness because of the hormonal therapy is counteracted with all this body habitus.
Well, we have new challenges in an economic depressed time where people may have not the economic resources, the financial security, and are cutting corners by eating foods that are cheaper, and therefore eating foods that have higher fat content and higher calories. And it's a real concern, especially in patient populations where money is an issue.
But the exercise, I think they don't have to get personal trainers. We're not talking about being part of it. They can walk. You know, it could be very simple things that they can do.
But diet's an issue.
Diet is an issue.
And I think we need to be very, very careful when you meet a patient with newly diagnosed breast cancer and all the stress of decision making regarding surgery and radiation, and being told about chemotherapy, and then announcing to them, oh, by the way, you need to lose an extra 60 pounds here soon. Careful with that. And the way I approach it is I have listed out, I write out a handwritten plan for each patient that explains the stage of their cancer in this column, and then the things we need to do: radiation, no radiation, drugs we aren't going to need to use. I list those. For instance, a HER2 negative patient, I list no trastuzumab, because I know someone from church or their neighborhood is going to tell them that my sister who lives in Georgia is taking this drug, Herceptin, how come you're not getting it? So they have this nice piece of paper to refer off of. And then at the bottom of it, I have my little lifestyle and dietary changes at the bottom. And while I'm sitting there, I have on my door an ideal body weight table, and we go and look at it, and I write it down there. But I put it at the bottom that this is our long-term plan. I think the other thing that's important, and I sympathize because I'm in the age group of most of my breast cancer patients now, it's very difficult to lose 10 pounds when you're a woman in your 50s and 60s. And I think what the information shows is sort of similar to smoking cessation. They need to be in some sort of program. And it's a program where you write down your caloric intake, you have a support group to go along with you, rather than just saying you need to lose weight and throw that in as another task when they've been given all this information about diagnosis and chemotherapy. So your point is correct with limitations and amount of money patients have to spend on food, and not to mention being able to get formal dietary counseling in addition. But there are programs, and I think my personal experience with Weight Watchers seems to be one of the best ones. And it again is a program where you have to write down your caloric intake, and when you look at that every day, that in and of itself helps you lower your caloric intake, plus you have the support, et cetera, rather than handing them a book that has a diet in it, for instance.
But at the same time, I want to mention that because, and I agree what you're saying, and obviously I'm not as blunt saying you have to lose 60 pounds, but this is a time they're going to be the most motivated. Mm-hmm. Okay, and they are out of control. They have something they've never had. Most of them, this is a first-time occurrence. You know, cancer is just the word cancer has very negative connotation. Now, of course, we are now talking about cancer survivors. We used to talk about cancer victims, but still people think cancer is not like ingrown toenail. It's a bad diagnosis to have, even though they know lots of friends who have survived cancer. But it's a shock, they're in a state of shock. And so what they want to know, what can they do? What can they do? They want some sense of control. Can I change my diet? Can I do this? And so, you know, lots of times physicians will say, well, I don't know, do I need to take vitamins? I don't know. I mean, you know, they don't give him anything to you know, so I give them something to get, and I say, we will address this in more detail down the road, but certainly we're going to have to do this and do that. And they feel, okay, so I can do something about this. I can, you know, it's a very non-control, you know, it's a shock to them when they get a diagnosis like that. What they can, you know, the only thing they think is about dying. And when we talk about exercise and diet, there's some kind of hope instilled with all of that too, because they think, well, I'm going to be around if they worry about my weight, you know.
But the other thing that's important in introducing it is introducing exercise first, and I have that on my list of things to do because actually exercise, and this is 4 to 5 days a week of something aerobic for 20 to 25 minutes, has an impact on reduction in risk of recurrence that's that's similar to getting toward your body mass index. So I tell them that even if you're not losing weight early on, let's just start the exercise program while we're going through chemotherapy, which we know has benefits while they're taking chemotherapy or even starting their anti-estrogens.
And there's decreased fatigue, with that.
And depression.
And depression and hot flashes and decreased infection. The endorphins goes up. I mean, it has multiple benefit.